Studies Session 7. Psychotherapies in Clinical Practice. Introduction. This lecture provides a general description of psychotherapy and explains various methods of psychotherapy used for clinical intervention. These psychotherapies go by many different names: psychoanalysis, behavioral therapy, cognitive therapy, humanistic therapy, group therapy, and on and on. In some ways, each of these psychotherapies has a set of unique defining characteristics or is directed towards specific kinds of problems. Objectives. At the end of this lecture, you should be able to 1. Explain specific characteristics of different psychotherapies. 2. Explain some basic components of this psychotherapy. Content. Defining psychotherapy. Wahlberg, 1967, defined psychotherapy as a form of treatment for problems of an emotional nature in which a trained person deliberately establishes a professional relationship with a patient with the object of removing, modifying, or retarding existing symptoms, of mediating disturbed pattern of behavior, and of promoting positive personality growth and development. It is basically seen as a systematic interaction between a therapist and a client that brings psychological principles to bear on influencing the client's thoughts, feelings, or behavior in order to help the client overcome abnormal behavior, adjust to problem in living or develop as an individual. Psychotherapy is not counseling, though there may be overlap. Counseling focuses on giving advices to help an individual in terms of specific situation. This speaks of a provision of an immediate temporary relief of solutions. But psychotherapy teaches or exposes an individual to healthy and lasting patterns of coping effectively with an adjustment to his problems. It helps the patient change unhealthy living patterns by assisting him to understand his inner self and how to deal with his present and future problems. Carson et al., 1998, posits that psychotherapy is based on the assumption that even in cases where physical pathology is present, a client's perceptions, judgments, expectations, and coping strategies also play a role in the development of the disorder and will probably need to be changed if maximum benefit is not realized. ITQ. A major factor that sets psychotherapy different from counseling is A. the mode of delivery, B. advices about specific issues, C. psychotherapy focuses on the treatment and changing or enhancing coping in more severe illnesses. ITA. If you pick A, you are wrong, because the mode of delivery of both counseling and psychotherapy are the same, which is talking. If you pick B, you're wrong, because there are situations when psychotherapy uses given advices, but it's just more than advice. If you pick C, you are right, because psychotherapy is more on the treatment of psychopathologies. Psychoanalytic therapy. Psychoanalytic therapy is the foremost and most often described as the father of all theories developed by Sigmund Freud. The approach of psychotherapy utilizes unconscious motives and conflicts in the search for the root of the behavior. It likewise depends heavily on the analysis of the past experience. In other words, psychodynamic therapy emphasizes the role of unconscious processes in the determination of both normal and abnormal behaviors. The following are the basic techniques used in psychoanalytic therapy. 1. Dream analysis. This is built on the rule that when a person is asleep, repressive defenses are said to be lowered and forbidden desires and feelings may find an outlet in dreams. The therapist's task then is to uncover these distinguished meanings by studying the images that appear in the manifest content of a client's dream and its preconscious association to them. Dream interpretation can be very tedious, but one can develop dream symbolism. The symbolism and dream are culturally interpreted. Some believe they are prophetic, while some regard dreams as patterns of thinking. 2. Analysis of free association. This is a technique of developing where the therapist encourages the client to explain and record what is going on in his unconscious. This can be done through interviews and observations. For example, there is normally called slip of tongues and often a revelation of materials in the unconscious mind. 3. Analysis of resistance. This is a technique which the therapist can use to assess some of the factors working against the progress of recovering rate of clients. For example, probing, paraphrasing, etc. Resistance may manifest in terms of inconvenience to talk about certain motives, giving aid to glib interpretation of some association, coming late to appointment or forgetting it completely, and such preventing painful and threatening material from entering awareness. Analysis of transference. This is a technique of assessing factors responsible for a client's direction of emotional feelings towards the therapist. As if it was the original source of his or her problem, one has to interpret, clarify this point. From this, you will know what to do because the patient may give an expression associating you with the cause of the illness to show that you are not responsible in your encounter by being empathic. Behavior therapy. Modern behavior therapy stems in large part from the work of Joseph Wolpe and B.F. Skinner in the 1950s. The therapy is based on the principle of classical and operant conditioning. It specifies the precise maladaptive behavior to be modified and the adaptive behavior to be achieved, as well as the specific learning principles or procedures to be used in producing the desired results. Behavior therapy methods are today routinely used in all facets of mental health treatment, and the field is continuously enriched by new contributions from research in general psychology. The following behavior therapeutic methods are discussed. 1. Systematic desensitization. 3 steps make up systematic desensitization. The first is training in progressive relaxation, a method of inhibiting anxiety. The second is constructing a series of anxiety-provoking scenes on the basis of patient's description of the problem. Thirdly, while the patient is deeply relaxed, the therapist asks the patient to imagine being in each scene until all feeling of anxiety have disappeared. In progressive relaxation, the therapist instructs the patient in tensing then relaxing muscles of the arms, legs, abdomen, neck, and head. By practicing at home, most patients become adept in quickly achieving a deep state of relaxation. Thereafter, the patient and the therapist jointly develop the series of anxiety-provoking scenes known as anxiety hierarchy. The average systematic desensitization procedure takes 10 to 15 sessions. It has proven remarkably effective in the treatment of phobias and similar anxiety reaction. In vivo desensitization, sometimes anxiety reactions can be corrected by exposing the patient directly to anxiety-provoking situations rather than imagining scenes. The patient is asked to stay in the situation until all feelings of discomfort subside. 2. Extinction. This is based on the fact that behavior patterns tend to weaken and disappear over time if they are not reinforced. Thus, the simplest way to remove a maladaptive pattern is to remove the reinforcement of it. This can be done through implosive offloading. 3. Modeling. In modeling, the client watches other people perform desired behaviors, thus vicariously learning skills without going through a lengthy trials and error process. For example, a therapist may show a 24-year-old student with a severe spider phobia how to kill spiders with a fly swatter and had her practice the skills at home with rubber spiders. The combination of live modeling with gradual practice is called participant modeling. It's one of the most powerful treatments for fear. 4. Assertiveness training. Assertiveness training teaches people to express their feelings in a direct and honest way that neither humiliates nor degrades other people. Acting assertively lets other people know how to see the problem, how you feel about it, and what you would like to do about it. Assertion training has proved especially effective for patients who tend to be anxious in social situations and who can react by withdrawing and feeling helpless. Aversive conditioning. Many unwanted behaviors are so habitual and temporarily rewarding that they must be made less attractive if the client is to have any chance of learning alternatives. Methods of lessening the appeal of one's desirable stimuli are known as aversive conditioning because they employed classical conditioning principles to associate physical or psychological discomfort with behaviors, thoughts, or situations the client wishes to stop or avoid. For example, alcoholics might be allowed to drink after taking a nausea-producing drugs, so that the taste and the smell of alcohol are associated with nausea rather than with usual pleasurable feelings. Still, aversive conditioning is unpleasant and uncomfortable. Its effects are often temporal. Many therapists thus avoid this method or use it only long enough to allow the client to learn alternative behavior. Contingency management. This involves the use of reinforcement to elicit and maintain effective behavior. It employs techniques such as shaping, taking economies, and behavioral contracting. Self-control procedure. A self-control procedure is a special form of behavior modification in which the person whose behavior is to be changed actively participates in designing and carrying out the behavior modification program. For the behavioral therapist, a self-control means that the person arranges cues, discriminative stimulus, and consequences, that is, reinforcers, in his or her environment to support new forms of behavior. Self-control procedures are especially helpful in changing ingrained habits like overheating or smoking, but they can also be used to support more effective studying, a regular program of exercise, or any other desirable goal. There are 3 steps involved in self-control program: analyzing situation, managing discriminative stimuli, and managing the consequences. 8. Biofeedback. Biofeedback is a method of teaching patients voluntary control over their muscular and visceral responses to stress so that they can realize and reduce body tensions. The most commonly used biofeedback devices are instruments that record the electrical activity of muscles and instruments that record hand temperature. The goal of muscle biofeedback is to decrease muscular tension, while the goal of temperature biofeedback is to increase hand temperature by dilating the undefined blood vessels. Thus, information about physiological activity is fed back to the patient so he or she can learn to control it voluntarily. Biofeedback is usually accompanied by training in various types of relaxation. Cognitive therapy. In our daily lives, our beliefs and thoughts influence our emotional reactions. Indeed, the cognitive behavior therapy stemmed from cognitive psychology and focuses on the effect of thought on behavior and on the study of the very nature of our cognitive processes and behaviorism with its rigorous methodology and performance-oriented focus. According to this therapy, when the critical cognitive components are changed, the behavior and the maladaptive emotions will change. Basically, there are 3 approaches to cognitive therapy. 1. The rational emotive therapy of Albert Ellis. 2. The stress inoculation of training of Donald Mekenbaum. 3. The cognitive behavior therapies of Beck. The rational emotive therapy by Ellis. The rational emotive therapy is one of the best known forms of cognitive therapy. Its originator, Albert Ellis, stresses that the emotional difficulties of many patients are due to what he calls the irrational beliefs they bring to bear on their experiences. His goal is to teach patients more effective rational beliefs. In rational emotive therapy, patients are first taught to recognize and then question their irrational beliefs. Patients are shown how to ask themselves questions such as, where is the evidence that I am a worthless person, if not universally approved? Who say I must be perfect? Why must things go exactly the way I would like? After recognizing their irrational beliefs, patients are taught to substitute more realistic alternatives. For example, rational alternatives such as, I would like to be approved. I would like to be approved, but I do not need such approval. What I do doesn't have to be perfect to be good. I will be happier if I achieve at a realistic level rather than strive for perfection. Or, if I can change the situation, it may be unfortunate but not catastrophic. I can make plans to make my life as enjoyable as possible to replace their irrational belief. Cognitive Behavioral Therapies by Beck. Aaron T. Beck and his colleagues developed a cognitive therapy designed for work with depressed patients. Beck, Rush, Shaw, Henry, 1979. Beck found that depressed patients suffer from a cognitive triad of negative beliefs about themselves, their future, and their experiences. These negative beliefs, according to Beck, are based on faulty information processing and faulty logic, such as ignoring positive information or overgeneralizing from single negative instances. Cognitive therapy for depression therefore consists of isolating, challenging, and changing erroneous patterns of information processing and thinking. Humanistic therapies. There are many different forms of humanistic psychotherapy. Some humanistic therapists differ only slightly from psychoanalytic therapists in their approach to treatment. They may use interpretations and analyze resistances, as does the psychoanalytic therapist. The major difference is that the humanistic therapists see the patient's behavior as an expression of his or her current feelings rather than a simple cue to past conflict or unconscious mind. Other humanistic therapists actively attempt to put the patient in touch with his or her true feelings and perceptions. Gestalt therapy. Gestalt is a German word meaning whole. Gestalt therapists often challenge patients to give up their facades, resistances, phony games in order to experience underlying feelings directly. The Gestalt therapist may ask the patient to act out a dream of a problem with another person in order to increase the patient's awareness of his or her immediate feelings. For example, a man who tapped the table while other people spoke was asked by a Gestalt therapist if others talking annoyed him. When he denied, the therapist asked him to experience the feeling behind his habit by tapping more vigorously. As he did, his anger mounted until he was pounding the table. This exercise made him aware of his hunger when others are talking, as well as his inhibited and unassertive response to it. The best known and most widely practiced humanistic therapy is that Carl Rogers' client-centered therapy. The best known and most widely practiced humanistic therapy is that of Carl Rogers' client-centered therapy. Client-centered therapy. The term client-centered implies a focus on the client's conscious experience rather than on the therapist's theory or techniques. The therapy is also client-centered in that clients are treated as fully responsible individuals capable of understanding and directing their own lives. Rogers, 1966, regards a warm, trusting, and accepting relationship between therapist and client as the chief ingredient of therapeutic change. Such a relationship helps the client become conscious of those aspects of experience that have been denied or distorted in the past. In coming to recognize and then accept his or her individuality, the client sets the stage for continued growth as a person. In order to facilitate these changes, the therapist must adopt and communicate these interrelated attitudes: unconditional positive regard, empathy, and congruence. According to Rogers, the therapist's attitude of unconditional positive regard, empathy, and congruence initiates a process of growth in the client. As the client realizes someone is listening and understanding, perhaps for the first time in any real sense, the client becomes aware of long-denied feelings and thoughts. The clients find that these feelings and thoughts are accepted by the therapists and moves towards accepting them also. Gradually, the client becomes a more fully functioning person, able to change and grow in ways that express his or her true personality. Group therapy. A group can powerfully influence the behavior, attitude, and feelings of its members. Group therapy is a way of harnessing its influence to help people overcome psychological difficulties and achieve more fulfilling lives. Therapeutic groups have several advantages over individual therapy. First, in individual therapy, there is no guarantee that the patient's newly acquired insights or behavior patterns will transfer from therapy sessions to daily interactions in the outside world. A therapeutic group gives the person an opportunity to test out new attitudes and behavior in relatively sheltered and supportive social situations. With feedback from therapists and other group members, the person can further modify and strengthen new ways of interacting. Second, the group participant can learn new ways of behaving by observing other group members as they work to become more effective people. Thirdly, a group member can facilitate new behavior by pooling information and experience and by reinforcing individual attempts to change. Fourthly, a group therapy is less expensive and a more efficient use of therapist time. Some therapeutic groups are extensions of well-developed individual therapies. Groups may be conducted, for example, on psychoanalytic, behavior, or humanistic principles. Some therapeutic groups of extension of well-developed individual therapies. Groups may be conducted, for example, on psychoanalytic, behavioral, or humanistic principles. Psychoanalytic group therapy with goals of insight and working through were among the earliest of the therapeutic groups. Certain behavioral therapies, especially systematic desensitization and assertion training, are often conducted in group settings. Encounter groups discussed below grew partly out of humanistic therapy. Other forms of group therapies have their own theoretical rationales that are independent of any associated individual therapy. The concept and the method of family therapy, couple therapy, transactional analysis grew largely out of attempts to understand and help troubled families and couples. Family therapy. Family therapy regards the family as a powerful system that both causes and sustains psychological disorders. Symptoms in one family member are often taken as a sign that the family as a whole is in disarray. The solution is to change the often rigid and destructive ways in which family members interact. The family itself literally becomes the patient. Like behavioral therapists, family therapists are often less interested in uncovering reasons behind a particular style of interaction than in directly intervening to modify it. To increase awareness of troubling styles of interaction, the therapist might ask the family to reenact a particular incident that they may have been discussing abstractly. Following the reenactment, the therapist might ask questions such as, how did that make you feel? Why does daddy always stay in the background? How would you prefer to see your parents to each other? At other times, the therapist might ask the family to practice new ways of interacting. With a family that has difficulty expressing affection, for example, the therapist might ask mom and dad to hold hands in front of their children or ask each member to say something affectionate to the others. As rigid rules are broken, a flood of emotion often occurs. Family members become aware of the unacknowledged styles of interaction responsible for their problems. With the therapist's guidance, they are then able to adopt more open, flexible, and mutual supportive styles of interaction. ITQ. If a client walks into therapy with a strong fear of spiders, which had hindered her ability to live normal, which of the following therapies will be the most appropriate to overcome phobia? A. Humanistic therapy. B. Behavioral therapy. C. Psychoanalysis. ITA. If you pick A, humanistic therapy, you are wrong, because to treat phobia effectively, you require more than accepting the expressions of the individual. If you pick B, behavioral therapy, you are right, because this psychopathology rests on behavioral responses, and altering these processes through conditioning, systematic desensitization, etc., can cure the disorder. If you pick C, psychoanalysis, you are wrong, because exploring the subconscious conflicts might help this disorder, but definitely not cure on the short term. Summary. In this lecture, it has shown that professional psychotherapy, no doubt, has come to stay and has become the greatest weapon in the hands of practicing clinical psychologists. Though there are variations in the field, including psychoanalytic therapy, behavioral therapy, cognitive behavioral therapy, humanistic therapy, and group therapy, all are aimed at understanding man's problem and how to assist him make a better living using different therapeutic techniques. End of study section 7. Thank you for listening.